हेलो दोस्तों, आज के वीडियो में सिर्फ वही नर्सिंग एमसीक्यूज़ हैं जो एग्ज़ाम में बार बार पूछे जाते हैं। वीडियो को एंड तक ज़रूर देखना क्योंकि लास्ट के क्वेश्चन सबसे ज़्यादा कंफ्यूजिंग है। और सबसे पहले आप सभी का दिल से थैंक यू क्योंकि हमारे चैनल पर हो गए हैं पूरे 50 सब्सक्राइबर्स। चलिए बिना टाइम वेस्ट किए शुरू करते हैं। क्वेश्चन नंबर 1, ए पेशेंट विथ इंक्रीज्ड इंट्राक्रैनियल प्रेशर suddenly develops hypertension, bradycardia, and irregular respirations. This condition is known as. Your correct option is option B, Cushing's triad. Moving to the next question, question number 2. A nurse is caring for a patient receiving mannitol for raised intracranial pressure. Which parameter should be monitored most closely? Your correct option is option B, urine output. Moving to the next question, question number 3. Which cardiac biomarker rises earliest after an acute myocardial infarction? Your correct option is option C, myoglobin. Moving to the next question, question number 4. A patient suddenly becomes unconscious, has no pulse, and the ECG monitor shows ventricular fibrillation. What is the nurse's immediate action? Your correct option is option B, perform immediate defibrillation and begin CPR. Moving to the next question, question number 5. In placenta previa, the characteristic bleeding is. Your correct option is option B, painless with bright red blood. Moving to the next question, question number 6. Which vaccine is given at birth according to the National Immunization Schedule? Your correct option is option A, BCG, OPV0 and hepatitis B birth dose. Moving to the next question, question number 7. Which type of shock is commonly seen in severe allergic reactions? Your correct option is option C, anaphylactic shock. Moving to the next question, question number 8. The first milk produced after childbirth is called. Your correct option is option B, colostrum. ये क्वेश्चन और भी सीरीज में रिपीट हुए हैं. मूविंग टू द नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 9. Which cranial nerve is responsible for the gag reflex or afferent limb? Your correct option is option B, glossopharyngeal nerve or cranial nerve 9. Moving to the next question, question number 10. During the active first stage of labor, cervical dilatation is. Your correct option is option B, 4 to 10 centimeter. Moving to the next question, question number 11. Which rhythm is treated with immediate defibrillation? Your correct option is option B, ventricular fibrillation. Moving to the next question, question number 12. Which acid-base imbalance is commonly seen in a patient with COPD? Your correct option is option B, respiratory acidosis. Moving to the next question, question number 13. Which vitamin deficiency causes pernicious anemia? ये भी बहुत बार रिपीट हो चुका है. Your right option is option B, vitamin B12. Moving to the next question, question number 14. The first nursing priority in a patient with active seizures is your correct option is option B, protect the patient from injury and maintain the airway. Always look the ABC approach. Moving to the next question, question number 15. Which insulin has the fastest onset of action? It's an important and tricky one. Your right option is option C, insulin lispro. Moving to the next question, question number 16. The antidote for opioid overdose is. ये क्वेश्चन भी मल्टीपल टाइम्स रिपीट होता है. हमारे प्रीवियस MCQ सीरीज में भी ये रिपीट हुआ है. So guess the right answer. Your option is B. B is the correct answer, naloxone. Moving to the next question, question number 17. Which vaccine is contraindicated during pregnancy? Guess the right answer and comment it down below. Your right option is option C, MMR vaccine. Moving to the next question, question number 18. Which cranial nerve is responsible for hearing? Your correct option is option B, cranial nerve 8. Moving to the next question, question number 19. The priority nursing intervention for a patient in hypovolemic shock is. शॉक एक इम्पोर्टेंट टॉपिक है, इससे बहुत सारे क्वेश्चंस आते हैं. सो हियर योर राइट ऑप्शन इज ऑप्शन बी, स्टार्ट IV fluids rapidly as prescribed. Moving to the next question, question number 20. The correct chest compression to ventilation ratio for a single rescuer performing adult CPR is. CPR से भी बहुत क्वेश्चंस आते हैं, ये भी पढ़ लेना. सो योर राइट ऑप्शन इज ऑप्शन बी, 30:2. मूविंग टू द नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 21. A patient has severe burns over 30% of the body surface area. The nurse's first priority is. Your right option is option B, airway assessment and breathing. Moving to the next question, question number 22. Which color bag is used for glassware in biomedical waste management? Your right option is option B, blue. Moving to the next question, question number 23. The normal cerebrospinal fluid is. CSF, ICP, all these terms are important. its normal value, its consistency, everything. So here the right option is option C, clear and colorless. Moving to the next question, question number 24. The priority intervention for tension pneumothorax is. Your right option is option B, immediate needle decompression followed by chest tube insertion. Moving to the next question, question number 25. A patient is admitted with acute pancreatitis. Which laboratory value is expected to be significantly elevated? Your right answer is option B, serum amylase. Moving to the next question, question number 26. Which nursing intervention helps prevent food drop in a bedridden patient? Your right option is option B, apply a footboard and perform ROM exercise. ROM means range of motion exercise. Moving to the next question, question number 27. A nurse is assessing a patient with meningitis. Which finding requires immediate reporting? Your right option is option B, positive Kernick sign with decreasing level of consciousness. Okay, moving to the next question, question number 28. A patient with chronic liver disease suddenly becomes confused, drowsy, and develops asterixis. Asterixis means flapping tremor. Which complication should the nurse suspect first? Your right option is option B, hepatic encephalopathy. Moving to the next question, question number 29. A burn patient weighing 70 kg has 40% total burn surface area. Burns. Which formula is commonly used to calculate initial fluid resuscitation? Your correct option is option B, Parkland formula. Sometimes they ask only what is Parkland formula, or sometimes they ask calculation based on this formula. So our next question, question number 30. During suctioning of an endotracheal tube, each suction attempt should generally not exceed. Your right option is option B, 10 to 15 seconds. Actually, below 10 seconds is the right answer, but based on these options, we choose option B. Moving to the next question, question number 31. Which condition is a contraindication for performing a lumbar puncture? Your right option is option B, increased intracranial pressure. Moving to the next question, question number 32. A patient with chronic kidney disease is most likely to develop. Guess the answer and comment it down below. Your right option is option A, hyperkalemia. Moving to the next question, question number 33. Which position is preferred immediately after thyroidectomy to reduce neck swelling? This is very important question. So your right option is option B, semi-Fowler's position with head and neck supported. Moving to the next question, question number 34. A patient with receiving total parenteral nutrition or TPN, which blood test should be monitored most frequently during initiation? Your right answer is option B, blood glucose level. Moving to the next question, question number 35. A patient with myasthenia gravis suddenly develops severe difficulty in breathing and inability to swallow. What is the nurse's priority action? Your right option is option B, prepare for immediate airway management and notify the physician. Moving to the next question, question number 36. Which nursing intervention is most appropriate for a patient with increased intracranial pressure? Your right option is option B, elevate the head of the bed to about 30 degrees with the head in a neutral position. So here basically it's a follow position with head in a neutral position. Moving to the next question, question number 37. A patient with Addison's disease is at greater risk for developing. Your right option is option B, hypertension and hyperkalemia. Moving to the next question, question number 38. Which finding is most characteristic of nephrotic syndrome? Your correct answer is option B, passive proteinuria with generalized edema. Moving to the next question, question number 39. Which nursing action is most important while administering packed RBC or red blood cells? Your right option is option B, use a normal saline line and monitor closely during the first 15 minutes. ब्लड ट्रांसफ्यूशन के टाइम पे नॉर्मल सलाइन के अलावा और कुछ यूज़ नहीं करना है. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 40. ए पेशेंट विथ कुशिंग सिंड्रोम is expected to have. Your correct answer is option B, moon face, truncal obesity and purple stray. Moving to the next question, question number 41. Which electrolyte imbalance is most commonly associated with prolonged nasogastric suctioning? Your right option is option B, hypokalemia. Moving to the next question, question number 42. A patient with pheochromocytoma typically presents with. Here, your correct option is option B, episodic hypertension, headache and sweating. Moving to the next question, question number 43. Which laboratory finding is most suggestive of disseminated intravascular coagulation or DIC? Your correct option is option B, decreased platelet count with prolonged PT and APTT. Moving to the next question, question number 44. Which assessment finding is most specific for compartment syndrome? Your correct option is option B, severe pain out of proportion to the injury, especially on passive movement. Moving to the next question, question number 45. A patient with severe head injury suddenly starts passing large amount of dilute urine. Which complication should the nurse suspect? Your correct option is option B, diabetes insipidus. Moving to the next question, question number 46. Which assessment finding is most characteristic of acute arterial occlusion of a limb? Your correct option is option B, cold, pale limb with absent distal pulses. Moving to the next question, question number 47. A patient receiving chemotherapy has an absolute neutrophil count or ANC count of 400 cells per millimeter cube. Which nursing action is the highest priority? Your correct option is option B, implement neutropenic precautions. लास्ट के ये 4 जो क्वेश्चंस ऐड किए वो सिनेरियो बेस्ड है, ओके. So next question is, a patient with liver cirrhosis develops abdominal distension due to ascites. Which nursing intervention provides the most accurate assessment of fluid accumulation? Your correct option is option A, measure abdominal girth daily at the same level. Moving to the next question, question number 49. A patient with acute angle closure glaucoma suddenly complains of severe eye pain, blurred vision, and halos around lights. What should the nurse do first? Your correct option is option B, notify the ophthalmologist immediately and prepare for emergency treatment. Moving to the next question and our last question, question number 50. A patient is diagnosed with syndrome of inappropriate antidiuretic hormone. Which nursing intervention is most appropriate? Your correct option is option B, restrict fluid intake as prescribed. इसी के साथ हमारा पार्ट 1 कंप्लीट होता है. आपका स्कोर 50 में से कितना रहा कमेंट में ज़रूर बताइए. और नेक्स्ट पार्ट इससे भी ज़्यादा और चैलेंजिंग होने वाला है. नेक्स्ट पार्ट के लिए वेट करिए एंड थैंक यू फॉर वॉचिंग द वीडियो.